we thought before showing our interview that it would be beneficial to give a little background and some characteristics of both ambulatory care, pharmacy, and academia, since that is what Dr. Acree, our interviewee, worked in. So we'll start with ambulatory care. Both of these summaries that I'm about to give are from pharmacist.com. So here we go. Ambulatory care pharmacy practices in the provision of integrated, accessible healthcare services by pharmacists who are accountable for addressing medication needs, developing sustained partnerships with patients, and practicing in the context of family and community. This is accomplished through direct patient care and medication management for ambulatory patients, long-term relationships, coordination of care, patient advocacy, wellness and promotion, triage and referral, and patient education and self-management. The ambulatory care pharmacist may work in both an institutional and community-based clinic involved in direct care of a diverse patient population. When it comes to Dr. Acree, she works in a clinic rather than a hospital, so that gives you an idea of the different places that they can work. Characteristics of ambulatory care pharmacists. 83 ambulatory care pharmacists responded to the 2012 APHA Career Pathway Evaluation Program survey. 23% of respondents held an entry-level pharmacy degree, 79% held a PharmD degree, 11% indicated that they also had a non-pharmacy bachelor's degree, and 10% indicated an advanced degree like an MA, MS, MBS, PhD, or other. 56% had been through a residency program, 48% had been through a certificate training program, and 32% held a BPS certification, and 3% reported having been through some other form of training. What else stood out to us in the interview was that she talked about how if we didn't have a residency that we would have less luck finding a job in the next few years because residencies are becoming more and more competitive, so having that would be very beneficial to us. When it comes to academia, the academia category may be loosely defined as belonging to a university faculty, usually that of a college of pharmacy. However, clinical practice pharmacists may also hold academic positions in medical, veterinary, and other healthcare-related educational institutions. Positions may range from the dean of a college of pharmacy to a teaching clinical pharmacy position at an off-campus site or to a classroom setting. Duties of an academic pharmacist may include administrative activities, scientific research, teaching professional student pharmacists, supervising research and teaching graduate students, speaking and or publishing in scientific venues, student advising, and teaching student pharmacists through experiential practice sites. Characteristics include the 134 individuals responded to the 2007 survey. 83% of the respondents had an entry-level degree in pharmacy, with 76% having earned a PharmD degree. 80% of respondents had a residency, with 12% having a fellowship. 17% reported an advanced degree, and an additional 24% indicated certificate training of some kind. So if you think about it, those percentages vary somewhat, but not as much as you would think, because 79% of ambulatory care pharmacists carry the PharmD degree, while 76 academia pharmacists had the PharmD degree. So there's not much varying there. Hi, my name is Emma Heisen. I'm a student pharmacist at the University of Charleston School of Pharmacy, and today I will be interviewing Dr. Acree. So Dr. Acree, as an ambulatory care academia pharmacist, what is the most challenging aspect, would you say, of your job?
It's time management. It's really hard to manage your time when you have children. It'll be really crazy.
What is your schedule like? Do you have much free time?
I do have a lot of free time. I have time to spend with my children, and I have time also to attend to their sport activity in school. So I have pretty much flexible schedule. I can work my time around.
So Dr. Acree, how long does a residency have to be for this job?
So it's 2 years for big universities and 1 year in smaller universities.
So as a student here at UC, which is a private small university, there'd only be 1 year residency?
Correct.
what would you say is your favorite aspect of the job?
My favorite aspect in academia when students really understand the topic and relate to it in their real life. And in my work, I really like to help improve the healthcare of the patient and see the patient like improve from unhealthy to healthy condition.
Do you know the job market availability and benefits of your profession?
So in ambulatory care, it has to tie up with academia and VA. It is really hard to find a job in small cities. However, it will be really easy to find a job in big cities.
Is there anything that you don't like about your job?
I do have a lot of meetings, so I really can't manage my time when I have a lot of meetings. So probably meeting is the worst.
I wouldn't like to sit in meetings either, so I don't blame you.
Yeah.
Was this always what you wanted to do as a healthcare provider?
It's actually not. I decided in my late 27th after I work in pharmacy and compounding pharmacy, and I really loved it. So it's so crazy because it's like baking but with a drug.
If you could be any other kind of pharmacist, what kind would you be and why?
I really like my job. I don't think I would change it, but if I had to choose, I would say compounding pharmacy.
Sounds like you like it a lot.
Yeah.
What is one thing about your job that you would change if you could?
As I said in the beginning, I don't like meetings, so probably meeting.
Can't say that I blame you. Is this job family friendly? Are you frequently on call?
Actually, my job is really family friendly. I have received several emergency calls from physicians, but I don't really have to leave the home for it. So I would say it is family friendly and no leaving.
That's good. I wouldn't want to leave my house. And last but not least, do you have any advice for us as student pharmacists?
I would say pre-reading is your smart thing to do. Please make sure that you pre-read the lectures before a class so you get the whole idea. Just scan, you don't have to go over everything. And buy yourself a whiteboard so you can take notes and make sure you understand the information from the lecture and make it easier and one whiteboard.
Thank you for your time. It was very much appreciated.
You can stop by my office at any time if you have any more questions.
Thank you.
Mm-hmm.
In smaller cities like that of Charleston, West Virginia, it is hard to find a purely ambulatory care pharmacy practice site. It's usually tied together with another position, such as one at a school of pharmacy or at the VA. It would be more simple in a larger city if you didn't want the responsibility of two jobs, so AmCare and academia, because ambulatory care in places that have larger clinics and hospitals, it's more available and time consuming, so you wouldn't have to have the academia as well. Like Dr. Acree alluded to in our interview, it's never too late to start your career. She didn't figure out that she wanted to be a pharmacist until she was 27 and had a child. So no matter what might be going on, there's always time to follow your dreams and passions. So the cool thing about our class is there's varying ages in our classes. It's not just straight out of college. So it's never too late for you to follow what you